Good afternoon, everybody, and welcome to the March meeting of the Health and Wellbeing Board. It's really good to see members this afternoon. For the benefit of members of the public, I'm Councillor Faith Heptonstall, Cabinet Member for Adult Health and Wellbeing for Wakefield Council and Chair of this board. Before I move on to the formal agenda, can I just remind members and those presenting today, if you can mute your microphones when you're not speaking, and also turn your video off when not speaking, as this can affect the quality of the screen and it can also affect our live feed. To ask a question, if you can just raise your hand on Teams or put a C or a Q in the chat box function, and when you're invited to speak, where possible, can you turn your camera on and introduce yourself first? That would be great, thank you. Can I also ask that you keep any comments or questions until the end of each presentation? That will be helpful. And I'd also like to encourage our presenters, where possible, if they can keep to time, to ensure that everyone gets enough time to speak. So thank you very much for that. So if we can move on to the formal agenda and just take apologies for absence. So I have Joe Webster, Beate Wagner, Lee Miller, and Gary Jevon. I don't know if we've got any further apologies.
Chair, we've got Nicola Esmond as well, but Kate Parker's here in place of Nicola, and Martin Barclay, Matt's in place of Martin, and Stephen Bates is here representing Lee Miller today.
That's great, thank you, Esther. Okay, so we can move on to item 2, which is the minutes of the last meeting held on the 24th of September. So could I have those moved to the correct record, please?
Happy, Chair.
Thank you. In terms of matters arising, I don't have anything to raise specifically. Everything is included on the action log, or it will be already covered in the agenda. But can I ask members if they'd like to raise anything, if you can just indicate, please. No? Okay, so I take it that everybody's happy, thank you. So that takes us on to item 3, which is Chair's announcements. It's been a while since our last meeting, and as you know, the January meeting had to be cancelled due to technical issues that arose at the start of the meeting. So I'm really pleased to see everyone back together again today. I'd also just like to take a moment to reflect on what's been a really difficult and challenging year as we marked the anniversary of the first lockdown earlier this week. We've all got our really own personal stories of what lives have been like over the last 12 months, both personally and professionally. And this week particularly, we've held in our thoughts all those who've lost loved ones. I want to also take the opportunity to thank the people of the Wakefield district for their amazing efforts in keeping to the restrictions, which has led to the case rate coming down. But I also need to stress the importance of continuing to be careful as those restrictions are eased. The vaccine delivery across the district has been absolutely tremendous over the last few months, and I can't underestimate the work that's gone into getting this up and running and coming together across the system to deliver this. And I think the fact that we've all got an history of working together has really helped this. It would be remiss of me not to acknowledge the continuation of all the hard work of members of the Health and Wellbeing Board, all the things that you're all doing across your teams. So thank you again, not only for responding to COVID, but also in the planning for the return to many services. And finally, Joe Webster can't be with us today, but I'd like to acknowledge the announcement made last week that Joe will be taking on the role of Corporate Director for Adults and Health from the 1st of April. As you all know, Joe's worked very closely with the Council for a number of years, and I'm really looking forward to how the new arrangements will bring great opportunities to connect our health and care system even better. So I'm really looking forward to that. That takes us on to item 4, which is urgent items, of which we don't have any today. And then item 5, members' declarations of interest. If I can remind members that they can make a verbal declaration of interest at any time as we go through the meeting, and we'll ensure that you receive the appropriate form. So thank you for that. Item 6 is public questions, of which we don't have any public questions today. And then that takes us on nicely to the action log. I find it really helpful to see the action log, which gives us a really good oversight of the progress that we're making and what we've achieved to date. So I'm just going to hand you over to Esther, who's going to take us through that, if that's okay.
Thank you, Chair. And if colleagues can remember, what we've found over the last few months is that some of the actions have perhaps not been progressed in the way that we would have liked them to previously because of the pandemic and the response to that, which has meant that a number of the actions have been paused over the last few months. I think it's fair to say, as things are now becoming a little bit different in terms of us returning to some of the business as usual. Hopefully some of these actions should start to progress over the next few months. But just to highlight, I mean, we do still have quite a number that have been achieved. There are a few outstanding in terms of the data on referrals. So this was where we had people attending A&E for self-harm and some looking at the referrals into specialist support for that. And I think that was paused because of obviously the work to respond to the pandemic in the hospital, so that's something we'll perhaps look to get an update on at the next meeting. Then also the opportunity to link the skills of adults who are socially isolated with young people who might need additional support. Again, this was paused, however there was an approach to how they might do this was agreed, I do understand. So again, this is something we'll have more detail on feedback in the action plan for the next meeting. The Healthy Schools programme being considered a future board meeting, so the next meeting we have in terms of best start, we might be able to get an update on this. However, we did have a presentation at the chairs meeting, so all of the Wakefield Together partnerships, the chairs and the coordinators meet quarterly, and we had a meeting earlier this week, and both the chair and I received a really good presentation around happy, healthy holidays, which comprise some of the elements of not healthy schools, but about healthy eating. So just linked to this slightly. There is a sort of a programme that's starting in the Easter holidays, and then it will progress into the summer holidays and holidays following that. There's some really interesting information in the presentation, so I have asked for a copy so that I can send it out to you all. There also is, by the looks of it, possibly an opportunity to make every contact count with that, because there's quite a number of packs that will be going out as part of this programme as well. So I will be sharing that with you as soon as I get a copy of that, and I think you'll all find that quite interesting. And then the last meeting we had in September, there were 3 actions which we've not had any update on since, because obviously there has been quite a significant challenge over the last few months in responding to COVID. So again, these are things that I just want to remind colleagues of, that we did agree we would bring back something on the Born in Bradford project, which would make sense to do in the Better Start focused meeting, but also the possibility of partners offering webinars on relevant subject matter to assist businesses in supporting their staff. So this was the action around staff who are furloughed and making sure they've still got really good support in place, and then also sharing details of available services to our colleagues in regeneration in order to maximise the Make Every Contact Count approach. So I would really just like to remind members that we had those actions in place, and hopefully now as we get back into a rhythm of normal meetings of the Health and Wellbeing Board, it would be really good to give some fuller updates on this at the next meeting.
Thank you.
Take any questions.
Yeah. Thank you for that, Esther. Have you got any comments or questions for Esther? No? Okay, thank you. Also, I just think it's important to say that as we're going through the meeting, obviously Esther will be taking any relevant actions as well from today, obviously, to feed into that log. So thank you. Okay, so with that, it takes us on to item 8A, which is the white paper, Integration and Innovation Working Together to Improve Health and Social Care for All. So that can be found on agenda pages 17 to 23. Members will have seen the white paper published in February and will no doubt have already had time to digest what it means for residents and for our health and care system. But I do think it's important that we come together for these discussions as well. Given where we are as a system in Wakefield and where we are as an ICS, I personally think that the white paper aligns well to the journey that we're currently on. but I'm going to leave it to Esther and Mel to go into lots more detail on that in the absence of Joe. So thank you.
Thanks, Chair. So I'm going to start by taking through some of the detail around the white paper and the implications for the ICS, and Mel is going to give the Wakefield slant on it, if you like. So as the Chair's just mentioned, the board will have seen the publication of the white paper, and this followed a consultation document which was published in November of last year. There were quite a number of responses to the consultation that were put in from the ICS, from each of the places, including Wakefield, and individual organisational responses as well. And it's really pleasing to see that actually quite a lot of those responses have been incorporated into the white paper, but it's really fair to say as well that not all of it has gone in there, unfortunately. So the paper sets out that a statutory ICS will be formed, made up of a statutory ICS NHS body and then a separate statutory and ICS health and care partnership. And that will bring together the NHS, local government and wider partners. So the ICS body will take on the commissioning function of CCGs and some of the direct commissioning from NHS. That is still taking quite a bit of working through at the moment. Each ICS NHS body will have a board, and they will be responsible for developing a plan to meet the health needs of the population, developing a capital plan for NHS providers, and securing the provision of health services to meet the needs of the system population. So ICSs will be able to delegate functions significantly to place level and to provider collaboratives, which will mean that, as we've hoped, in Wakefield and in West Yorkshire, the vast majority of work will continue to happen at place. That's always been our ethos, about making decisions and planning for our populations as close to the individual as possible. So the ICS board itself will, as a minimum, include a chair, a chief exec officer, and representatives from NHS trusts, general practice and local authorities, and also non-executives, and I would imagine that we would want to put lay members there as well. The board will be directly accountable for NHS spend and performance in the system, and the chief exec will become the accounting officer for the NHS money allocated to that body. In order for them to also address broader health outcomes, which is something that we've always and will always continue to do in the West Yorkshire ICS and at place level, the ICS Health and Care Partnership will be made up of a wider group of organisations than what's in just the ICS NHS body. So the partnership will develop a plan to address health, social care, public health needs of the system, and then each ICS NHS board and local authority will have to have regard to that plan. Members can be drawn from a number of sources, including health and wellbeing boards, partner organisations with an interest in health and care, and organisations with a wider interest in local priorities as well. So we will be able to determine that membership as an ICS, and it's important to remember that we do have a board that reflects that quite well at the moment as well, which the chair and Anna are on that board. Place-based arrangements between local authorities, NHS and providers of health and care will be left to local organisations to arrange, and the statutory ICS will work to support places in integrating services and improving outcomes, which again, that's something we have been doing for quite some time now. And health and wellbeing boards will continue to have an important responsibility at place level to bring local partners together. So for Wakefield, that's the board setting the strategy and the ICP for the most part driving the delivery of that strategy. ICSs will be able to decide how they can align their allocation functions with place, for example, through joint committees, and there'll be a duty placed on the ICS NHS board to meet the system financial objectives, and they require financial balance to be delivered. And again, in a shadow form, we've been doing that as an ICS in West Yorkshire for some time. There is a duty to collaborate. That's a duty introduced to promote collaboration across healthcare, public health and social care system. And again, we've built our ICS in West Yorkshire on relationships, values and collaboration. So this isn't new to us. But what we will need to do is to make sure that the new statutory nature of the ICS doesn't affect the way that we're already working, and that it just enhances it. So in terms of joint committees, it will be made easier for organisations to work closer together through joint committees. So provisions will be set out, the governance of these joint committees and the decisions that can be delegated to them. Commissioners will be given more discretion over when they have to use procurement processes to arrange healthcare services. So there is a new provider selection regime which will provide a framework for NHS bodies and local authorities to follow when deciding who will provide those services. That's out to consultation at the moment, and we are responding as a partnership on that regime. There are some new powers of intervention for the Secretary of State to intervene in reconfigurations, although they will need to seek appropriate advice in advance of their decision, including in relation to value for money. And there are also measures to make it easier for the Secretary of State to direct NHS England to take on specific public health functions. There'll be a more clearly defined role for social care within the structure of the ICS NHS board, and that'll give adult social care a greater voice in NHS planning and allocation, which hopefully, I think we can say that we do that in West Yorkshire at the moment, but hopefully it will enhance that. So the proposals reflect very much what we already have in West Yorkshire and Harrogate, as the Chair has already alluded to. Our way of working and our journey and pathway to the future really align well to this document. They include primacy of place and the key role of health and wellbeing boards and provider collaboratives, which is very much at the heart of everything we do. And they emphasise the importance of ICSs having the flexibility to develop their own arrangements, particularly at place. And as I mentioned earlier, there are some absences in the paper in responding to our concerns, particularly around the abolition of CCGs on accountability, clinical leadership and public and patient engagement at place level, and also really not an acknowledgement of the cumulative disruption on some of our staff in our system as well. So we've been constantly evolving as a partnership. We'll continue to do so over the next 12 months and beyond, responding to the white paper. And over the next year in particular, as we work to design and transition, we'll be focusing on 6 key work streams, which are highlighted in the document that you've got there, all of which are part of the whole, the same whole, which come together and describe how our partnership will function from April 22. And all of those groups have representation on them from all of the sectors and places across the ICS. We'll continue to bring some updates back regarding the ICS transition and design, and also the legislative documents. And we anticipate some of that coming back to the next meeting in July, but it'll be an important thing for us to keep touching on. But obviously, importantly for this board is the Wakefield element to this, and how this impacts on Wakefield and the development of our journey in Wakefield. So I'll hand over to Mel now to take you through that.
Thank you very much, Esther. And just for the purpose of the public listening to this recording, my name is Melanie Brown and I work for Wakefield CCG and Wakefield Council as a Commissioning Director for Integrated Care. And very eloquently, Esther's taken the white paper, and all of that sounds really fascinating. But I think for us in Wakefield, we have worked in this environment for a number of years now, and I suppose for some other areas who have just announced that they're going live with an integrated care system in April 21, it'll be a bigger change for those 11 areas that are starting that journey, rather than we've been involved in this journey for the last 2 or 3 years, and we've been able to shape the emergence of West Yorkshire and Harrogate integrated care system. So although there is some significant changes in this white paper, you know, what I just want to spend a couple of moments on now is really, what does this mean for us in Wakefield in terms of what we're going to do to improve health and care for our residents in the district, and also, you know, what can we expect to see differently moving forward as a health and wellbeing board. So I'll just cover those 3 areas if that's okay, Chair. You've already heard from the chair of the meeting earlier on that this white paper really does complement the way that we've been working in the Wakefield system, and it is very much the direction of travel that we had been putting together in our health and wellbeing strategy back in 2018. There's a big emphasis in this paper on how we come together as a system to reduce health inequalities, and that's a big focus of our 4 priorities that we are working through in terms of the Wakefield Health and Wellbeing Board strategy. The chair of the meeting earlier has just shared with you that one of the practical changes that we are testing and trialling in the next 12 months is bringing our health and care commissioning system together across both the council and the CCG. And as the chair of this meeting highlighted, we're going to trial for 12 months Joe Webster bringing together sort of adult social care, public health, NHS commissioning, so that we can really lead on the improvement of population health planning for our health and care system across our district in Wakefield. I won't repeat what Faith said earlier in terms of Joe assuming the roles of the Corporate Director of Adult Social Services, but this does give us a very unique opportunity to think through how we can drive forward practical health and care integration delivery, as well as looking at the Wakefield Pound wants, making sure we use that effectively moving forward. And it's going to obviously enhance some great partnership work we've had for a number of years in this district, but it'll deepen that to an extra layer, really. Excited by that. I have to be open and say we're the first area in the country at the moment that has taken this approach so quickly, and so all credit to the local authority and the CCG for recognising and really putting into practice the reality of the white paper. But all of that sounds really great, but what about what we're going to do to improve care, patient experience and resident experience for our population? Well, just to give you some assurance, we will be developing a number of work programmes, which we can come back to the Health Wellbeing Board at our next meeting to discuss further, that will be really informed by the feedback that we've had from our residents that have experienced different experiences during the pandemic, so that we know that there's certainly been some improvements in some service areas that have worked together very dynamically and differently during the pandemic, but we've also had some quite rich feedback from a number of Health Watch surveys from our public that have highlighted areas where we need to enhance and improve further. So we will be doing some more work on how we can overcome some of that feedback from some of our residents. Some practical examples of this: we're going to do some further work on mental health. We've had a lot of feedback from our patients and residents around access to mental health services, and now in Wakefield we have something called the Mental Health Alliance that are working really hard to respond to that feedback and put together some new areas of work in 21-22 to deliver some either new services, enhanced services, whether that's with our local child and adolescent mental health services or with wider providers that deliver inpatient mental health care in Wakefield. Equally, we also know that sadly for some of our wards there will have been a deepening of health inequalities during the pandemic, and so one of the areas that we want to focus on moving forward is looking at an opportunity to do some more targeted work to reduce health inequalities, and we'll bring a lot more detail about this, but I just want to provide the board with some assurance that we will not be getting stuck in a governance tunnel. Really, there will be lots of work that we'll practically do that our public and our residents will see a difference to the way that we work together in the next 12 months. Obviously the white paper and the legislation does provide some opportunities in Wakefield to be able to manage a reasonable size amount of resources delegated from the integrated care system. And we will have an opportunity to do that through our integrated care partnership locally, which very much delivers some of our key actions for the Health and Wellbeing Board at the moment. So we do need to strengthen our integrated care partnership and make sure it's ready to do that work as outlined in the white paper. But I'm confident that with the partners that I'm working with on that integrated care partnership, many of whom are also on this Health and Wellbeing Board, that we will be able to put those arrangements in place to be ready for these changes in April 22, and it's likely that we may go into some shadow arrangements from September 2021 as well, so that we can just test that out before we go live in April 22 to respond to the new legislative changes. I think that one of the things that I would just like to highlight really is that, you know, this new this white paper may seem you know, another sort of change in the deck chairs really from a number of organisation changes we've had over the years. You know, in the past we've had primary care trusts and CCGs, and now we're going to have obviously West Yorkshire Integrated Care System. But I think what I want to assure the board is that we've got some very talented staff and workforce that are going to be working really hard on this agenda together across the council, the CCG and wider health and care organisations. Those staff are just simply going to transfer over into new organisations, but we won't lose that talent in Wakefield. And I think that's really important. So the relationships that we've built up with our residents in our communities and with the services they're delivering will you know, for our public and for our residents, there'll be no change really in terms of how they access services. And I'm happy to say and answer any further questions. A lot of this detail I need to be open because the paper only was published in February. We are working through in detail with the integrated care system how it could all work together, and we are populating that more fully over the next 6 weeks. So we could bring a much more detailed update to the next Health and Wellbeing Board meeting. I'm very happy, Chair, to take any questions. I realise we're a bit light on detail at the moment, but I just wanted to give that assurance to the board that our focus will remain on how we enhance care for our public and listen to our residents' voice to be able to improve experience of wider health and care services across the district.
Thank you, Mel, and thank you, Esther. That were really comprehensive. Do we have any comments or questions for Esther and Mel? Adam, would you like to come in?
Thank you, Chair. Just to comment that this all sounds quite complicated and sort of related to changes with governance, but the crux of the matter is it will allow us to build on what we've got in Wakefield as a place and to do better for our citizens, our populations and our patients, because it allows cross-organisational working and think of us as just one system in Wakefield. So certainly as a clinician and my perspective as Chair of the CCG, I think it's a real opportunity. The bit about governance or where the technicalities happen will be a bit different, but the same people will be around the table, improving the services that, you know, we've done so well on in the last year or two. So please don't see it as a threat. I believe it's an opportunity and a chance for us all to work together better. Thank you.
Thank you, Adam. Do we have any further comments or questions? No? Okay, thank you, everybody. So if I can just ask the board to support the recommendations. So if we can note the report to the West Yorkshire Partnership Board setting out the proposals in the white paper and the implications for integrated care systems, to note the implications for the Wakefield health and care system, and to agree a further progress update to be brought to the July meeting of the board. Is everybody okay with that? I take it that silence is good, so thank you. So thank you, Esther and Mel. Okay, so that takes us on to agenda item 8B, which is the key impacts of COVID on health inequalities in Wakefield. This is a discussion that we've been having throughout the pandemic, and it's important that we continue to have these discussions so that we can actually turn them into something real and meaningful. So one of the recommendations today is to consider tasking the Wakefield Integrated Care Partnership to develop the proposals to bring back to a board development session for tackling issues raised. So with that, I will hand you over to Anna. Thank you.
Thanks, Faith. I'm just going to put my slide up. So can you see those okay?
I can't see anything at the moment.
Yeah, I was going to say, I don't think you can. I don't seem to be showing my screen. Let's try again. Hang on, there you go. Right, is that better?
That's it, thank you.
Brilliant. So just at the risk of being the public health person that comes and depresses everybody, I just thought it would be really helpful for the board to see some of the latest findings from the Institute of Health Equity, and that's the MAMA Institute. And I just think that given that our entire sort of approach is built around those kind of MAMA outcomes, this is kind of some of the most recent data around COVID. This is very generalisable to our Wakefield population, and really sort of takes us through some of the impact And whilst it does make quite sober reading, I think a lot of the things we're doing, like particularly that have just been outlined in the previous conversation with Mel and Esther, is that approach, that kind of integrated approach, and very much tackling kind of the wider determinants, working together to do that. So anyway, I'm going to take you through these slides. There's quite a lot of slides, and I've taken out some, but I do feel it's really important to get that kind of broad picture. But I'm going to set my stopwatch because I know I've got 20 minutes. So firstly, this isn't a slide you'll have seen many times around mortality rates from all causes, but what this is showing you is that COVID impact as well. So you've got your most deprived population on the left and your least deprived population on the right, and the dark green is your all causes, and that brighter green is COVID, and your non-COVID are the grey. And again, you can just see that that slope there, really indicating that for those more deprived populations, they have had a kind of very different kind of experience than those least deprived. And a really good phrase, I don't know whose phrase it is, but I've been using it, is around, we're all in the same storm, but we've been in very different boats. And I think that's really true when we see this sort of data in front of us. So this is for women, and you can see quite a similar picture there. And then if we look at Wakefield itself, these are our deaths, and you can see again our most deprived on the left and our least deprived on the right, and it's really quite stark there, where if you're in the least deprived area, about 30 and 100,000 deaths is what you've experienced, whereas the most deprived is sort of 170 per 100,000. And I mean, death is always a really good proxy measure for sort of other outcomes. So we know that our infection rates have been fairly stable across the population, no matter where you live. But for admissions and deaths, they've seen this relationship between deprivation and those outcomes. And I think it is worth reflecting that certain communities will have been will have had far more devastating outcomes, and that for those deaths, for every one of those deaths, there's families, there's children who've been affected, and thinking about that as we shape our work going forward. And I think again worth reflecting that particularly in our Wakefield population, we knew that areas where people have generally had lower levels of good health, so going into COVID, so COVID has really shone a light on what we knew was already there. And sort of reflecting on the fact that if we could get our population to the sort of the healthy place of the least deprived, how much less COVID would have impacted on us as a district. So again, I just wanted this is quite sort of strategic, this presentation. I want to talk about the country as a whole, and we're also going to talk a bit about where we sit within Europe. So the percentage of excess mortality compared with the trend in each region of England in the previous 5 years. And again, we've got COVID and non-COVID deaths. So your bright green are your non-COVID, and your sort of grey green are COVID. And again, look at the difference in when you look at regional excess mortality. So Northwest has been the hardest hit, then the Northeast, and then Yorkshire and Humber. Whereas if you're in the southwest of the country, or sort of, you've had almost you've not had a huge impact from COVID over the last year in terms of sort of excess mortality. And again, if we look at that in terms of Europe, and this is all-cause mortality from January to June 2020, you will see that England is right at the top there, having experienced the greatest mortality for both males and females. And so, again, really, really sobering if you think about sort of the impact on the population as a whole, but also how disproportionately the impact has been in England compared to other countries. So you'll know that the Margaret Review, which is what we've based the whole of the Health and Wellbeing Board outcomes on, was reviewed. So there was a review 10 years on, and the results of that review came out last year. You'll also probably remember that we were going to have Michael Marmot visit Wakefield as part of Minding the Gap and speak to us about his review, but sadly we've had to delay that because of COVID to some of the findings. So you can see that the increase in life expectancy that we have seen on this graph, it starts at 1980. Unfortunately, in around 2010, those life expectancy increases started to stall and have kind of levelled off. And again, if you look at us across kind of a year, not just the UK, but actually across Europe, and this is life expectancy improvement in weeks from 2011 to 2017, you can see that we are quite low, well, very low, compared to kind of other European countries. And the report would actually describe health inequalities having widened. And I know we've brought this to the board before, but most worryingly, we've actually seen life expectancy decrease for the 10% most deprived women. And you'll know that we've done a lot of work on looking at that data and trying to find out why that is. And it does seem to be linked to lower income, and we're particularly seeing that around sort of cardiac deaths, etc. That we are seeing those mortality rates increasing, and obviously, this research, COVID has really kind of emphasised that, and we've got these regional differences. I think the other thing which we always mention is that time spent in poor health. So it's not just about people dying; it's about living a healthy life, where you can live a good life. So, we know about austerity. We know there's been large funding cuts. Those have affected the social determinants. So we know that housing and income are the kind of the two things that have the biggest impact on your overall health and well-being. That is very, very frustrating. So this is a quite interesting slide, which is looking at overcrowded households and local authorities and how comparing that with the COVID mortality rate. So down the left, you've got the rate of death involving COVID per 100,000, and across the bottom, you've got the percentage of overcrowded households. So you can see Newham's an outlier in London, and that, you can see that they have a very high percentage of overcrowded households, and they've also experienced high numbers of deaths. And again, you can see a relationship on that graph between overcrowded households and deaths. And when we do get a bit of stick, don't we, for our numbers remaining higher than perhaps other parts of the country, but clearly some of the underlying factors around that, of course, impact, and this being one of them. The other really interesting, I think, graph is around mortality rates around occupational group. So again, you can see that our professional and technical occupations have had a much lower rate of death than our caring, leisure and other service occupations. So again, it is that sense of we're all in the same storm, but in very different boats. Some employment, of course, has been far higher risk than others, and we know that for all sorts of reasons. And then not just the job that you do, but obviously if you don't own a car, you may have had to continue to use public transport. There'll be other risk factors around that. And so this is the 17 occupations with raised risk of COVID that come from Black, Asian and minority ethnic groups. And again, you can see that the rate of deaths are far higher than you would expect in other professions. Again, sort of very, very concerning. We know that Black, Asian and minority ethnic communities have had a disproportionately poor experience during COVID, both in terms of kind of becoming poorly, but also dying. And again, it does really reflect the underlying inequality within our society. So containment, of course, has a massive impact on inequality in health, these are sort of key areas where a containment will have had an impact. I won't read them out because you can read them, and I think we all know, we all recognise that, even if you've had your kids at home for a lot of the time, if you've got enough room in your house for, someone to be in each room, and you also just things like IT. So if you've got tablets and laptops and things your children can work on, lots of young people have had to work on mobile phones. I mean, that's, can you imagine doing sort of your work on your mobile phone all day? Very, very challenging. And obviously lots of great work's been done in Wakefield district around digital inclusion and providing laptops and providing support. But of course, the being off school doesn't impact on everyone the same. So this is a really good slide to demonstrate this, and this is about teachers reporting loss of learning in schools. And you've got sort of not behind at all on your left hand side, and 6 months or more behind on the right hand side, with your least deprived being in the dark green and the most deprived being in the light green. And again, you can see how for those most deprived young people on children, they're 6 months or more likely to be 6 months or more behind, and your least deprived population are not behind at all. So again, I think this can shape, and I think it does shape our policies and the way that we do things, and I think we can really take this learning forward around the work that we do. And I know it's happening, and we're doing this already. So there's been a huge programme of work getting sort of laptops out to people, you know, catching young people up. Just around unhappiness and depression, again, I know that's a really sort of a subject very close to our heart, and again, a lot of work going on in the Mental Health Alliance on this. So you can see that for females, there's been that real kind of rise in particularly that 16 to 34 age around unhappiness and depression, and greater really than sort of any other population group. So again, I know lots and lots of work going on, and just sort of demonstrating how important that work is. And then I know we're very well aware around domestic abuse, but the you know, you can see how the top line is 2020, the bottom line is 2019, and again you can see that big difference there in call outs, and of course, you know, it doesn't take any stretch of imagination to imagine how horrendous it must be to be trapped within you know, a household with somebody who you know, it puts you at risk. I think, you know, again, this is around unemployment for young people, and you can see that top line is your 16 to 24 age group, and they are far more at risk of unemployment. We know that a lot of young people work in hospitality industries, all of the, you know, Topshop closing down, all of those impacts. And again, I know lots of plans in place for local organisations to be upping their apprenticeships. You know, I know sort of we've had some really interesting conversations with Mid Yorkshire about what do they do as a community asset, how do they kind of, and they've already done, I think we all remember seeing the young people with learning disabilities who came to talk to us about the programme, the Project Search programme they're involved with, that where they were doing placements at Mid Yorkshire Hospital, and what a massive difference that had made to their lives. And I think it, you know, if it's our response is about a proportionate response, then young people and unemployment is a key one, because you know, I'll never forget that young person looking at us and saying, you know, I never thought I'd be able to have a job, and I've got a job, and it's made all the difference. And you just think, yeah, that, you know, it's the Health Foundation have done some really interesting work around mental health for young people, and the 3 things that came up was employment, housing, and social connectedness. And you think, yeah, there are things that we can do as employers in this district to help those young people sort of get, and we are doing, to help those young people get on that employment ladder. And again, you know, pretty obvious stuff, but low income workers most likely to be in shuttered sectors. So, you know, of course we know that, you know, we're well aware of that, but again, quite stark when we see it like that. And again, this has a regional huge impact in terms of the regional differences. So the green, the darker green is not furloughed, and the lighter green is furloughed. But we can see how that's not necessarily exactly the same across the whole country. So the recommendations are around sort of a national strategy on inequality. This is what the Institute Marmot is recommending. And I think if we think about how at a local level, because we don't sadly have our gift isn't a national strategy, but I do believe that we do have a commitment and a strategy that we've got the health and wellbeing strategy, which is excellent. We're going to be sort of refreshing that and building on that. Proportionate universalism, so essentially that's saying we need universal solutions, but we need to give additional support to those who have additional need. Again, I think we understand that well, and we have many examples of this, but I think, you know, going forward, I think we need to constantly reflect, are we providing more to those in greatest need? And there's lots of things we are doing and we can do. And again, I know, you know, just talking about Mid Yorkshire, because I've had the chance to be at their board recently, but looking at services, who's accessing those services, where are they from, those kind of questions. And then again, it's not in our gift to level up regional inequalities, but I think we can, you know, sort of flag this and kind of and raise that where possible. So again, the sort of recommendations are absolutely still the recommendations that we recognise, and the ones that we have for our board are the sort of every child the best start in life, healthy standard of living, healthy and stable place in communities, and strengthening the role and impact of ill health prevention. And you know that the way the board's structured is that we haven't done it during COVID, but we will start again doing that real sort of forensic spotlight on those four. And then this was just the last recommendation, and I left this slide in. I think when we talk about a public health system, we're not talking about the public health team. I think all of us are part of the public health system. And just again, a reminder that around the social determinants of health, that's so key. And Sarah Roxby presented at the ICP around some of the stuff they're doing on housing, and you know, it's just brilliant that our partnership involves, you know, is absolutely doing those things that we should be doing. You know, I don't know how many partnerships in the country that are based within sort of a CCG have housing sort of front and centre, but you know, it's a marker of the success of what we're doing that we're taking that approach, and that's something I think we can build on and we can continue to do. And I won't sort of dwell in that. Of course, I think we should get more funding. Of course, we haven't received any more funding this year. We've had a more or less standstill budget. So I think I got a 0.67, so less than 1% increase. And obviously, we have increases that we need to fund. But you know, it does feel a little bit frustrating that given the necessity of many of these interventions that are vital for our population, that the resourcing doesn't necessarily follow that. So I'll stop there. I think I've done 16 minutes. So welcome, very happy. Obviously, it would be really good to hear people's sort of comments and questions, and apologies for depressing you all.
Thank you, Anna. I mean, I found that really sobering. You know, the data, I know we've heard some of that data before, and it still continues to be really sobering. And I think how we can work together to change the reality for people is absolute. You know, it is absolute key, as you've already said. Do we have any comments or questions for Anna? No? Or Esther?
Hi Anna, thanks for the fabulous presentation as always. Obviously, a lot of these things will be tackled through our existing strategies and refreshing our strategy. Mindful that the domestic abuse slide was quite stark, and obviously, although that in Wakefield is part of the Community Safety Partnerships remit, we have had that discussion here at the Health and Wellbeing Board before in terms of signing off the domestic abuse strategy for Wakefield. And I'm just wondering whether at some point, at the right point in the future, it might be helpful to revisit that in terms of the current climate and what more we can do in terms of making every contact counts to support some of the victims of domestic abuse in the district. So it might just be something we want to think about in the future.
Yeah, great. I think Glyn Humphreys is here today, so obviously that sits under him now. So it's, I think yeah, you're absolutely right. I know Glyn's very keen. Sorry to speak for you, Glyn, but I know you're very keen to make relationships with this board and look at how we can kind of be really joined up with many agendas, including sort of the domestic abuse one.
Yeah, absolutely. It is fall under me, and that's one of the things we're working on at the moment. We're looking to make as many strengths and links between each services. So happy to get involved as moving forward.
Thank you, Glyn. Mel, would you like to come in?
Thank you, Chair. We just wanted to sort of take an action forward on behalf of the board to take forward the recommendation that's outlined about the integrated care partnership, coming up with some proposals of how we're going to take this forward, and just to give the board some assurance, we've got some time out on the 30th of March, which is next Tuesday, so we'll have some time to reflect on some of this and bring some ideas back to the next Health Wellbeing Board, if that's okay, Chair.
That's great, thank you, Mel. So just sort of to formally say then that, just to double check that the board is happy, as in the recommendations, to note the presentation, and as Mel's just said, for the Wakefield Integrated Care Partnership to develop proposals to bring back to the board development session for tackling the issues raised. So is everybody okay with that?
Yes, thank you, Chair.
That's great, thank you. Okay, so that takes us on to agenda item 8C, which is the Wakefield Climate Change Action Plan. Have we got everyone here who's due to present, Esther?
We have. I think we would. Councillor Hemingway was hoping to join as well, but I'm not sure whether he's been able to as yet.
Right. Okay. So we had hoped to have had this discussion at our January meeting. While it wasn't possible in January, I'm aware that the climate change lead for West Yorkshire and Harrogate had briefed board members on the work being led at an ICS level, which is obviously a great foundation for future discussions. There's so much as a health and care system that we can do to tackle climate change, and I would urge everybody, all the partner organisations, to think about what they can commit to. Climate change has got a huge impact on health and well-being, and we've seen this in Wakefield in terms of where people have been affected by floods, and also by the way in which some of our population with respiratory problems are affected by poor air quality. The contributors and the solutions of climate change also have a great impact on health and well-being. So, for example, moving from cars to bikes and walking being an example. So we have Gary Blenkinsop and Glyn Humphreys with us this afternoon, who's going to present this item, and possibly Councillor Jack Hemingway, Deputy Leader of the Council, will be joining us as well. So with that, I'll hand over to yourselves, Gary and Glyn, if that's okay.
Chair, if I could just start, I don't think we've got Councillor Hemingway here yet. I've not seen him anyway. Thank you so much for inviting us along. It's really important for us. Obviously, the council set ourselves a climate emergency. By 2030, we'll be carbon neutral. I think we all know realistically that's a huge challenge. Gary's going to do a short presentation just to talk about the plan that we've been working on tirelessly over the last 12 months or so. But I think it's fair to say is the challenge that we've got, you're right, is a massive challenge, and it's all of us. And we've been talking to Joe Webster in terms of how we can strengthen the links and synergies between both, as all. And just tying up on that last comment as well, we're a newly formed directorate as such. People who don't know me, I should introduce myself. I am Glyn Humphreys, so I'm the Corporate Director for Communities, Environment and Climate Change. I'm certainly not new to Wakefield, some of you know that, so I've been this is my 40th year. We're absolutely committed to working across partnerships. So even though we're talking about climate today, I'm always keen to work on any other areas as well, like we talked about domestic abuse, things like that. From our perspective, thank you ever so much for inviting us. And I see that Councillor Hemingway has just come on screen as I'm talking. So I don't know if you want to come in, Councillor Hemingway.
Yes, thank you, Glyn, and thank you to colleagues on the board for inviting us to speak today and address you on our climate change plans. I don't want to say too much because I know that Gary has prepared a really detailed presentation on the work that we're carrying out, but I'll just make a few opening remarks. I think in Wakefield we recognise that our climate is in a state of emergency and that this represents a fundamental challenge to our current way of life. It's a crisis that is on a planetary scale, but it really does have impacts both on our country and specifically on our district as well. In terms of freak weather, we've seen the recent flooding which affected communities in Horbury and parts of Castleford. We've had different parts of the world which will eventually impact on consumers here as well. And of course, there are health impacts from climate change in terms of heat waves and extreme cold and the impact that has on vulnerable citizens. These are all going to become much more commonplace as a result of climate change. That's one of the reasons we've made it a political priority for the council. We've put in place a new climate change team and our 2030 action plan, which you'll be hearing about today. And we've already taken some practical steps to start the journey towards net zero. But I think the key message for us today is that we can't do this alone. We very much want to work with partner organisations, businesses, charities, the community, to help deliver emissions reductions and to work together to build a cleaner, greener district for our residents. I know that a lot of organisations around the table will probably already be considering your own emissions reductions targets, and if we could collaborate and work together on those to maximise the impact of that for Wakefield and for the planet, then we'd be doing future generations a great service. So again, thanks for inviting us to talk today, and I don't want to steal Gary's thunder, so at this point I will pass over to Gary to talk you through the presentation.
Thanks, Jack. Thanks, Glyn, and thanks, Board, for inviting us to talk about it. I'm Gary Blenkinsop, so I'm the Service Director for Environment, Street Scene and Climate Change within Wakefield Council. And I think it just shows that with the leadership that's being given through the Council on the climate change agenda and how we're showing that leadership and commitment to trying to tackle from a Wakefield's perspective and a regional perspective how we can lead and contribute to tackling this most important of issues. I have got some presentation. I'm going to try and bring it up now, so just bear with me. It's just a few slides. It should take about 10 or 15 minutes. Just bear with me. If you can say when this appears.
We can see them, Gary.
Okay, that's great.
It's just a little bit small. I don't know whether you could make it a little bit bigger.
Oh, no, that's not right. Just bear with me. Apologies.
Perhaps we'll go through it, and if people...
Okay. I can't quite get it onto the full presentation, so display settings. I think it'll be that one. Okay, I'll go through it. I've introduced myself, so I'll go to the next slide. What I'm going to do, it's really in three parts is this presentation. One is a little bit of setting the scene, setting the context around climate change. What is it? Various targets that have been set, trying to make a little bit of sense of that. Then what the Wakefield Council approach is and the climate change action plan, some of the themes. I'll start teasing out a little bit around the areas of action, what makes a difference, and those sorts of things to show what's important, how we can start reducing our own climate carbon footprint and impact on it. And then really then moving a little bit into the regional context. Finally, then just really posing some questions at the end about what we can do collectively, what the Health and Wellbeing Board can contribute to this agenda really as a way of a discussion. So start with the commitments and an international context and local context. So just to put people might be aware at a sort of planetary, if you like, global level, in 2015 there was a Paris Agreement which agreed to limit global warming to 2 degrees and preferably to 1.5 degrees compared to pre-industrial levels. So this is what you'll refer to as the Paris Agreement, and which the 196 countries committed to and set that as a legally binding limit. On top of that, at a UK level then, back in 2008, the first Climate Change Act came in, which created a legally binding target of achieving 80% reduction in emissions 2050. But following the Paris Agreement, this was updated in 2019 to become a net zero UK by 2050. So that's a date that you'll see often referred to 2050 for the UK. In June 2019, so the same sort of time, there's a lot of activity in 2019 around climate change, following on from the government's commitments, and local authorities and other organisations started to take this really seriously. At that point, there was a lot of Extinction Rebellion and protests around the world, Greta Thunberg, etc. And it became really evident before COVID and that year before. People will see the demonstrations, etc. So organisations such as the Combined Authority at a regional level gave a commitment to achieve a net carbon zero region by 2038. And of course, actually just before this, Wakefield itself in May 2019 declares a climate emergency and commits to be a net zero organisation by 2030, which is the date that Glenn mentioned earlier. So that gives some context. I think we know those dates actually are all really, really challenging unless major change takes place in how we actually tackle this important issue. But we must start somewhere, and these are increasingly stretched targets, 2030, 2038. Some local authorities have even set dates like 2050. That's some of the context there. In terms of the NHS has set its own net zero targets. So for direct control emissions to be net zero by 2040 and reducing emissions by 80% between 20 organisation, much more on a much more significant scale than direct emissions. They're aiming to achieve a net zero by 2045, and again with an 80% reduction sooner than that. I think you can get hung up on the date sometimes. I think what's important is that there's a sense of urgency around it, and that we need to push as hard as we can, as fast as we can, to reduce our emissions, which are contributing to climate change, and showing that sense of leadership. Just the next slide shows a little bit of the context of where we are with global CO2 emissions, which we are, of course, are the principal cause of climate change. And this just shows over the last 30 years about how those have increased year on year from fossil fuels. So that's the most significant contributor, and that's largely down to a number of factors on a world scale of growing population, growing development across the world, increasing urbanization, increasing transport use, increasing heating and extraction of fossil fuels, greater commercialization, etc. So that creates more industry, more demand for power to conduct those things. So you can see the growth in global emissions across that time scale. And that trajectory would continue without any intervention and cause problems for the climate moving forward. So the next slide just sort of shows what that trajectory needs to be in terms of achieving net zero emissions, and how soon that needs to take, those sort of reductions need to take place. So the black line shows the trajectory we're on at the moment, and the green, blue and red lines show what the trajectory needs to look like to achieve carbon zero. I have to say that we're at the moment, globally, these are not on track at all, and it'd be interesting to see at COP26 later on this year in Glasgow, which is the climate change international forum which considers these matters, how on track and how much in peril we are at meeting the Paris Agreement commitment. But this shows the sort of changing the curve that's required in order to achieve those climate commitments. This sort of shows what the problems will be unless we do achieve that change in direction. If there's no policy changes, the chunk at the grey, if there are no changes made, the predictions are that by the end of this century, the temperatures could have risen by nearly 5 degrees, which will be absolutely catastrophic for the planet. So there's a definite need to change, and that's why this is so important. Current policies, the shaded area in blue, 3 to 3.5, 3.7 degrees on the current trajectory, still massive impact on a planetary basis, and then gradually moving down to the sort of reddy colour and greeny colour, sort of the improving situation. But nonetheless, even on the lower end of that, there are still increased issues with things like flooding and those other things, and the impact is obviously, as you can imagine, is problematic, increasing problems depending on how much that goes. This is why there's an urgency and a need to act now on this subject. Just a quick slide, which one of my colleagues likes to show, and I thought it shows things in context. I don't know if you can see this one, but obviously COVID is what's hitting us now. Recession potentially, climate change coming beyond that, but it shows in a simplistic form the scale of the issue that can come if we don't start tackling it. So that puts a little bit of context of climate change, mainly internationally, globally, planetary, in terms of the problem, the scale of the problem, and the need to do something about it. Just moving into Wakefield then, we have developed our own climate change action plan, looking at what Wakefield Council can do, both in terms of its controlling its own emissions and also looking at its influence that it has through as a leader, a policy maker, place shaper, those sorts of roles that the council has in tackling the wider emissions. I'll just go through a little bit of context around that. You may have seen this sort of thing before. This graph shows really what we're talking about when we're talking about emissions, and there are various things what they call in terms of scope 1 emissions, this sort of arrow in the middle, which is those things which are usually burning fossil fuels directly, such as gas, oil, diesel, petrol, all those things which are fossil fuels, and as a result of burning those things, and we all do every day of our lives, whether it be the gas heating our homes, or offices, or buildings, or factories, to the vehicles we drive, are by and large burning fossil fuels. Those are called scope 1 emissions. Then we have the grey thing, which is scope 2 emissions, which is electricity in the main that's used. So obviously that is currently on a world scale mainly coal burning, or gas burning, or oil burning to produce a majority of energy and electricity. Increasingly it's renewables such as wind and solar. So that scope 2 emissions is that element to it which produces the electricity. So when we turn on a light switch, it's not emission free. Somewhere upstream from that, something is being ferry bridge or another power station or a wind farm on the North Sea is producing that. So the amount of energy that is CO2 emissions associated with that. Indirect emissions is actually a large chunk, sometimes hidden, difficult to quantify. So the amount of products and that you might consume goes into things like construction, the purchase of goods along the way, all that, and the transport of it, the waste that is produced, and those sorts of things. All those have an energy element to it, and it's somewhere upstream, and so that's called indirect emissions, and those are some of the biggest chunks, both what's upstream and downstream. So things we do create ourselves, and things that may be downstream when they're used by others. So and it's not just CO2. Methane, for example, is one of the biggest factors from methane gas produced in waste industries, that if it's not captured and goes to landfill, it's something like 25 times more potent than CO2 as a greenhouse gas. The other hydrofluorocarbons, others are also potent greenhouse gas emissions, but actually produce less so. There's been a lot of controls putting those in the industry. So CO2, methane, and nitrous oxide is some of the other areas that cause greenhouse gas emissions. Just breaking Wakefield's emissions down. So we've done a baseline of how many tons of CO2 equivalent, which takes into account those other types of gases. And in 2018, we estimated there were just over 35,000 tonnes emitted by Wakefield Council as an organisation, taking into account those Scope 1, so things that are produced directly or emitted directly from heating our buildings, and the transport that we use, to Scope 2, which is the electricity we use in our buildings, to Scope 3, which is some of the elements we've talked about in terms of waste and other areas. This is probably underestimated, if we're being honest, but it is a hard and inconsistent way, hard to sort of measure sometimes, an inconsistent approach in local authorities and under other organisations about how that's measured. So those are the estimate. So the big area is Scope 2 for us. So this is electricity usage and how we can decarbonise that. So that's one of our big challenges. So the approach we take is one that's a common methodology or hierarchy. So we avoid having to use this wherever we can. So things like might be reducing our building stock. So we're having to heat and use energy less. If we can avoid doing something, that's one of the best ways. If we don't need to make a journey, that's good. All those sorts of things. If we don't need to use a product, if we can do something less, that's all good. So the less you use in terms of energy, the less emissions that are produced. Then the other ones are reduce, substitute, and compensate. So reduce, is obviously you might have a more efficient way of doing something. You may improve energy efficiency of a building. You may swap a vehicle for a hybrid electric vehicle or something like that, so it's using less emissions compared to a fully diesel or electric. Substitute is excellent in terms of you might change to a heat source from a gas boiler, for example, to an air source heat pump, which uses electricity rather than gas. And so long as that electricity comes from a renewable source, you're substituting the impact. But big decisions around that. And finally, it's really difficult to take everything out of the system, so there'll always be an element of what they call compensation as the last one, and this is sometimes referred to as offsetting. This is where your carbon offsetting occurs through accreditation schemes such as tree planting and other carbon capture, so growing more trees and planting those and accounting for the carbon that they absorb from the atmosphere through sequestration is one of the ways you can offset, and we'll come to that a little bit more detail. Just in terms of the action plan, there are 6 work streams that we've developed. 5 are internal looking, and the 6th is more externally facing. So work stream 1 is just, as I mentioned before, looking at our own property. How can we swap out and reduce that hierarchy to decarbonise our buildings and other energy uses? And you'll see a picture there of a street light, for example. So we're already rolling out an LED street lighting program. So this is sort of substituting the lights that were used previously to a low energy light, and this is going to save considerable amount of energy and make some savings along the line. In our buildings, we're looking at energy efficiency and swapping out traditional forms of heating to other ones. Again, massively challenging in a retrofit situation, but you'll see the image at the bottom. Things like ground source heat pumps as a way of getting energy and heat from the ground into buildings, and that's a growing use, but it's very difficult and challenging to do that in a retrofit way. We are looking at a project currently around our mine waters. We've got a legacy of mines in the district. A lot of the deep mine shafts, etc., have got water in them. That's at a higher temperature. So if we can tap into that and extract that and use it in a way that is brings that heat into buildings, it's a way of reducing the impact. The next work stream is looking at our fleet, and as you might imagine, that's largely electrification of fleet. The technology, particularly for smaller vehicles, is there, ready to go. It's just building the infrastructure around that. Heavier vehicles, it is emerging and developing, and all these, so these technologies are being looked at currently. The next element, this is the biggest area for us. As I said before, there was 67% of our emissions are around use of electricity. So we're looking to use our assets, our land, to develop energy parks, to generate our own electricity and use that in a green way within our corporate estate. So that's probably one of the biggest areas of importance we're looking at, because this will account for the biggest improvement and offsetting our own emissions. And on work stream 5, it's carbon offsetting, and I've mentioned earlier before. So we've got a massive tree planting project. Called the White Rose Forest, and it's an element of the Northern Forest, and so we'll be planting hundreds of thousands of trees over the coming years, and each of those we will look to be putting through the Woodland Carbon Code carbon offsetting accreditation scheme to help offset whatever we can offset totally through the substitution, avoidance and reducing mechanisms that I mentioned previously. There'll always be this element. So they're very tangible physical things to try and get to that carbon zero position. But we also have sort of a cross-cutting theme, which is around behaviour change and influencing. And so this covers things like our decision making. So all the decisions that we now make as an organisation, or the key decisions we make as an organisation around spending and procuring, and those have a climate change theme. So to make sure that those are considered and wherever possible embedded into those decision making. Carbon literacy training is one that we're looking to roll out. It's been a bit challenging as that over the COVID period, just getting that off the ground, but we are looking to raise awareness and building that into everyday understanding. So we're all talking the same language and do understand what the direction of travel we're going in. Sustainable procurement, this is a massive opportunity, particularly for those downstream and upstream emissions where we're buying products and services. It's a massive amount of influence that we can exert in the system through using the public spending money to influence suppliers and providers to impact on the emissions that they produce. So the hidden emissions that come through that sector is absolutely key. I just put the donut economics sort of image there in terms of some of the decision makers around this ambition to make sure that we start operating in a different way from moving from this consumerist type approach to one that operates in this safe and just space in the middle of the donut. So it's within the ecological ceiling, the environment, the ecology that we live in. It doesn't exceed that, and it doesn't impact on individuals and the social foundation as well. So we operate as a society, if you like, in this area here, and that's an emerging and interesting way of looking at things moving forward. So we're not just thinking about economic decisions in the traditional sense. We're thinking about it in a much more wider and holistic way. I think there's a long way to go on that still. For the Western society, particularly, to get our heads around that. Just moving on to the final work stream. So all those are mainly inward focusing for an organisation, but the sixth work stream is around the regional work. So I've just put one slide up on this. This is an area of work that really is in its infancy, if we're being honest, but we're probably linking up much more with West Yorkshire Combined Authority, because they've developed emission reduction pathways to reach the 2038 target. And this is looking at the same sorts of things, but at a regional scale. And this slide just gives a sort of a sense of scale of what's required. So for tackling transport, some of the estimates there is that sales of zero emission cars need to reach 50,000 a year by 2038. So that's significant. It was helped by government policy, which have said that by 2030 they'll ban sales of petrol and diesel vehicles by 2030. But of course, there's got to be an alternative to that. That's going to be electricity, electric cars, and that needs infrastructure building around that. Increasing walking and cycling by 80% compared to 20, which is 20 times compared to today. Again, a massive shift in modal shift there. And public transport capacity increases 55% compared to where we have now. So they're massive ambitions to get to their 2038. Excuse me. Just on buildings and industry, in the region we're looking at 680,000 homes to reach energy efficiency standard of C or better, and that's about insulation of homes. Installing 665,000 heat pumps between 2020 and 25, and developing hydrogen as an alternative fuel in industry. Land and agriculture use, protecting that, and of course power, as we mentioned before, bringing solar PV as a massive, and onshore wind to bring 770 megawatts of energy in the next 10 years. Just to give that some context, the two solar farms that mentioned for Wakefield, that would be around 40 megawatts, and that would be Wakefield Council's emissions or electricity usage. So it gives a sense of scale of that. Carbon capture and storage and electricity infrastructure, just to give a flavour really of the sort of things that are needed and the scale of what's needed from a regional perspective. So I just wanted to end with a couple of slides, or a slide on what some questions to pose really about Health and Wellbeing Board, and what can we as partners do. As Jack said, it's really important that we collaborate, work together. The first one, as I've mentioned, is really need to be leading by example as the public sector. People will be looking to governments and public bodies to lead. So have organisations declared their own climate emergency? Have we got a climate change champion in organisations? And what commitments have we been given to be a carbon neutral organisation? So that sense of leading by example. So understanding where you are as an organisation, and have we got a plan to achieve a net zero position. Again, it shows that sense of leadership. Other words without a plan or action that is followed through is just words. It needs to be actually driven through to actually achieve where we need to be. I think this is probably one of the most influential one that can happen particularly in areas that have massive commissioning or procurement budgets. The amount of influence that you can have in this space by just tweaks to procuring or commissioning policies, to ask the questions of services that are being commissioned or goods and services that are being procured. Along the way, can have a massive impact on the downstream emissions. And if there was one thing that anyone was going to do from this, is take that away and see how that can be influenced. And incorporating climate change into decision making, so it becomes part of every day. I think, if I'm being honest, we've got that in Wakefield, and it's the right way to go. But I do sometimes, obviously, I think it's important to not silo out climate change as well. If I go back to the ecological ceiling and the social foundation element of the donut economy principles. There is a lot more complexities and issues to take into account in decision making, as well as just climate change. So it's a much more complex set of circumstances that need to be taken into account when rather than just one. But nonetheless, climate change is one of the most urgent things that we need to address in society, and incorporating that into things we think about and do in terms of decision making, I'd say is build it into the everyday. And the final one is just about collaborating with partner organisations. There's lots being set up now, and I've just put a few bullet points up there in terms of the ones that we have. Obviously, Wakefield Council logo, we're leading a lot of this in the Wakefield district. But obviously, we've got now the newly set up Yorkshire and Humber Climate Commission. We're very lucky to have Jack as the vice chair of that commission, paving the way as West Yorkshire's representative. West Yorkshire and Harrogate Health and Care Partnership, and I think you heard from Janish, who's leading that up in the partnership, working collaboratively with them. West Yorkshire Combined Authority, again, massively influential, a lot of experience, and actually quite a bit of funding, particularly around transport, that we can help to work together, and other things, like the principles of one public estate, joining together on things like building usage, etc., is a way that we can work together. Joining up with schemes around energy use. If you've got land that you've got available that might be accessible for a solar farm or a ground source heat pump, or those sorts of things, what is it around that land that can be tap into that as a low energy source or a renewable energy source? So it's thinking differently, really. And that's about it from me. Just an opportunity to ask any questions. I'm pleased, quite happy to take any further questions if anybody has them. But thank you for the opportunity.
Yeah, thank you, Gary, for a really, really comprehensive presentation. I certainly found that really interesting, and you've given us all quite a lot to think about. Can I open it up to questions and comments for Gary, Glyn and Jack? Anna, would you like to come in?
Yeah, thanks, Faith. So firstly, Gary, thank you for giving an even more depressing presentation than mine, which I didn't actually think anyone could achieve, but I feel you did, so thank you.
I certainly did that, Anna. Sorry about that.
And secondly, and this is probably a bit of an unfair question, but I'm going to ask it anyway. So it was a really good presentation. Thank you, incredibly comprehensive. Obviously, COVID has massively reduced. We know that COVID has had a huge impact on society and emissions and nature and all of that stuff. I'm just trying to get my head around the graph demonstrating how much we would have to reduce our emissions to avoid devastating consequences. Do we get any sense of, over the last year, with flights having stopped and people not driving, whether would that be enough to reduce those emissions to the level that we need to see them?
The short answer is no, nowhere near enough. There's been obviously it's had an impact. There's been some reductions. Travel, particularly in the lockdown one, fell by 20-25%. That sort of figure has an impact. But we're talking about net zero. So
yeah,
we're still using gas in our homes. We're still using diesel and petrol in our cars and vehicles. So to get it, that we're talking about much more substantial and much bigger change than COVID will bring. It's a massive change in the way we heat our homes, and really what we've done, Anna, is for the last 150, 200 years we've extracted fossil fuels which have locked up carbon in our ground for billions of years, and we've released them in a relatively short space of time in the last 200 years. So that's had a massive change in the environment, and what we didn't realise when we started doing it, it was going to cover the whole of the planet in a blanket and start warming it up. But that's effectively what we've done, and we need to reverse that trend on an international level. So COVID has got us thinking differently. It shows what we can do when we're faced with an emergency, COVID has presented. And that's the same sort of way of thinking that we need to had about COVID that we need to apply to climate change. So that in terms of the change it's made to a society, nowhere near enough.
Thanks.
I think Anna could just add as well. I think it's a really good point you make. Clearly, it has made a impact, but not to the significance that we were looking for. But I think as we start to build back from COVID, it's really important for colleagues and people listening online to look at how they're going to build back. You know, what do we really need to go back to where we were before? And if it can assist in any way moving forward, this is about our responsibility. About every little bit now helps towards this climate emergency.
Yeah.
Yeah, thank you, Glenn. Thank you, Gary. Esther, would you like to come in? Then after Esther, I've got Linda.
Hi, thanks. It was a really, really interesting presentation, Gary. Just thinking in terms of how we can best help you as well, because you're sort of acting as the representative for health and care system in the West Yorkshire and Harrogate ICS in terms of climate change. So I just wondered whether you've got all the links you need from each of the partner organisations and whoever is leading on climate change in their organisation. So how best we can support you with that, for that flow of information, but also helping in the links between all our different strategies and making sure that the decision making has got the climate change woven into it. So just making that linkages, I guess I'm saying in a really bad way.
No, absolutely. It's just a really good question. Yeah, it's a really good question, Esther, and absolutely the right question to ask. And I think if I'm being honest, our focus very much has been around our internal organisational side of things, because that's what our pledge has been. But I think we appreciating, and I am certainly appreciating, that we need to take more of a connecting together role with partners. So I think over the coming weeks, I'll be looking to make contact with the partnership organisations at a Wakefield level, so that then we can properly work together on some of these schemes from partner organisations. There are some good examples of work going on. If I think of West Yorkshire Ambulance Service, that they've been pushing some of the boundaries here for many years, and I think we just need to collaborate. Things have, we've been in the midst of everything for the last 12 months with COVID and those sorts of things, but I think there's an opportunity now to pull things together at a Wakefield district level, and then we can start tying the networks together. I think what the key thing that myself and Glenn and Jack, I think, are wanting to do is probably ensure that the different things that are happening both in the district and the region are actually tied up better, because I don't think they are currently, and making those connections. So I think we'll end up being a little bit of the glue that sticks some of this together. So I think we'll hear some more from us on that, in that one, in terms of joining the partnership together.
Thanks, Gary. Can I suggest, Chair, that if all the partners around the table are able to either let myself or Gemma know who the right person is for Gary to get in touch with in terms of climate change in your organisation, and then we can provide that linkage.
That's great, thank you, Esther. Can I bring Linda in next, please?
Yes, thank you very much, Chair. Echo comments on in terms of the comprehensive nature of the preparation. I think it's one of the best sort of whole system approach presentations I've seen on this subject for a while. Esther, in many ways, your question answered my observational comment, really, was how, as organisations who are in varying stages of our relationship to this vital agenda, can be connected. I think that there will be enormous benefit from climate change champions, from our individual organisations being able to get together, share best practice and consider our different approaches to this so that they can synergise. So fully support, but in many ways, Esther, I think you've already paved the way for that, so thank you.
Thank you, Linda. And I think I've got Sean who wants to come in.
Yeah, thanks. I think, Gary, you'll have already made contact with Nick Phillips and his colleagues, hopefully. Nick's our lead officer responsible for this, and just to highlight to colleagues that our Trust Green plan is on our board agenda on Tuesday, so the board will be discussing and hopefully approving that. So I'm sure Nick will be talking to you about in due course. Thanks.
Thanks, that's great news. Thank you.
Thank you, Sean. Do we have any further questions before I bring Jack in? Okay, over to you then, Jack. Thank you.
Thanks, Faith. Yeah, and thank you very much, colleagues, for your interest in this topic and for those expressions of joint working. I think one thing we're clear about in Wakefield, we already have very strong partnership arrangements across a variety of areas, health and community safety being just two examples. So I think it would be absolutely fantastic if we could create strong partnership arrangements around the climate and the green agenda, and where we can collaborate and maximise our impact, then we really should do so. I think this year presents a unique opportunity in many ways. We've talked about the impact of COVID, and we know that's been severe, and it's changed the way that organisations and individuals operate and think. And it would be a shame to waste the chance to move to something different, to not build a new consensus and new arrangements as we move out of the pandemic. And I think we have an opportunity this summer in particular as lockdown restrictions end. We've got the COP climate conference coming up in the autumn to try and capture the public imagination, the public mood on this, and work together as organisations around Wakefield to publish green ideas, promote interest in this topic, and generally kick off a district-wide conversation about what we can do on climate change. I know the council is looking at delivering a summer festival programme themed around this topic and themed around the earth and the natural world. So there's certainly scope for us to have a moment in Wakefield where we all come together to tackle climate change. So just to thank you all for your interest, and hopefully we can start to forge a strong partnership around this agenda as we move forward. So thank you, Chair and members of the board.
Yeah, thank you, Jack. Gary and Glyn, we've really appreciated the presentation today, and I think as you, well, as everybody's alluded to, I think that continued collaboration is absolutely crucial, and I think if we can just keep that in mind as we move forward, you know, that's perfect. So thank you.
Thank you.
Okay, so I'll just sort of go through the recommendations from that report. So the Health and Wellbeing Board are asked to note the presentation and the accompanying action plan, and to consider the contribution of health and care to achieving the aims of the climate change action plan, as we've already discussed just there. So is everybody okay with that? So I take your silence as agreement, so thank you. So with that, we'll move on to agenda item 8D, which is supporting carers and vulnerable groups during COVID. I mean, this is something, as you'll know, that I'm really, really passionate about, and I can't begin to articulate the importance of carers in our response to COVID. And I feel we really need to ensure that we continue to support all carers at this time. Vaccinations for carers have been an important part of the vaccination programme, and I'm looking forward to hearing about the work and the support that's been given. So with that, I'm going to hand over to Justine, Maria and Pam, who's going to take us through the presentation. Thank you.
Thank you very much, Chair. So my name is Pam Shepherd. I'm the Senior Programme Manager for the Unpaid Carers Programme for West Yorkshire and Harrogate, and I'm joined by Justine from Carers Wakefield and Maria from Wakefield Council. So we're going to do a little bit of a triple act on this one. So if we can go on to the next slide, please. So one of the things we do know is that, as the Chair has referred to, COVID-19 has adversely affected many of our vulnerable communities across West Yorkshire and Harrogate, and Wakefield being one of them. And there was a report conducted last year by Carers UK that really gave us some really stark information about the impact of the pandemic on carers. So we know that 70% of carers, and I know that went up higher towards the end of last year, are providing more care than ever before due to the outbreak, and it's impacted them both emotionally, physically and also financially as well. at the beginning of the outbreak, Carers Wakefield referrals were also down by 60% on the same time last year. And we also knew that there was roughly around 8,000 carers on the Carers Wakefield and district database. We also know that a lot of carers are women living in poverty, usually younger, and also juggling caring along their paid employments, with as many as 100,000 people in the UK undertaking unpaid work and having to resort to using food banks. So that just gives you a little bit of an idea of the impact of this pandemic on so many of our unpaid carers. If we can move on, please. So the feedback that we were getting from carers across Wakefield, and the insight from Carers Wakefield showed that a lot of carers were worried about their loved ones getting ill. They were worried about contracting the virus themselves and not being able to attend hospital appointments. And in quite a few cases across Wakefield and other areas, carers had actually had to move in with their loved ones. And for some, this had actually impacted on their own health. We also saw that there was an increase in COVID infection rates due to the new strain of the virus. And also with the subsequent lockdowns, this impacted on the health and well-being of carers who continue to support loved ones with either long-term conditions or who themselves had contracted the virus. There was also a shortfall of the number of carers that we knew were actually physically caring. So, you know, there was only 8,000 registered with Wakefield practices, but we knew there was an awful lot more who didn't know how to access the vaccine within their GP practice, or also didn't really understand if they would be eligible for this vaccine. Next slide, please. So in February 2021, with the release of the JVCI vaccination guidance and the notification about cohort 6 that would now include carers, we worked across West Yorkshire and Harrogate with the Unpaid Carers Programme and worked across our partnership to develop a regional approach that would raise awareness to increase carer registration and uptake of the vaccine by informal carers during the delivery of cohort 6. We developed a document which was really a practical way of deploying mechanisms that would encourage more unpaid carers to self-identify in order to be eligible for the vaccine. And this definition was agreed across our partnership as follows. So it was A, somebody that was in receipt of carers allowance, or B, somebody that was living with a person that they care for or in the same support bubble, or somebody who was providing regular or at least weekly intense care and support for an individual with which they would be at risk of harm or for which there was not a ready alternative. So those were the 3 criteria, any one of those criteria that would enable someone to come forward for the vaccine. So with that approach in mind, we worked with Carers Wakefield and District and the CCG and the local council to develop communications and a robust process to promote the vaccine to carers as part of this priority group. What we felt we needed with this regional approach was a lot more leniency and flexibility, because the JVCI definition was very restricted to people that were either in receipt of carers allowance, and it wasn't really clear about who could come forward, which could actually negate a lot of people receiving the vaccine. So this was something that we wanted to rectify. Next slide, please. So you'll see here that this was a process that we undertook with Carers Wakefield and partners to basically start with the sign up, which was agreed with the leaders across the ICS and including Wakefield, of course, and also our voluntary sector leaders. We developed communications, including posters and press releases, to really get carers to come forward, but also to inform primary care and other partners of what we were doing and why we were doing this process, which was really, really important. One of the things that we had to be really careful of was that general practice as we know it is under immense strain due to the number of people that are trying to contact them during this time, and as well as the vaccination programme itself. So we had to formulate a process whereby we encouraged carers to contact their local voluntary sector organisations such as Carers Wakefield, and then receive registration as a carer, which would then enable them to either go back to their GP practice and get registered through a PCN, and the data to be passed on to that PCN in order to actually recognise them as a carer, or in some places it was through the local authority and the MBS booking system. But in Wakefield, what we did was develop a process with data quality team, primary care, to actually get a process where we could register carers, and then we could take their details with all the governance in place to do that, which was a lengthy process, and then supply that data to practices to upload code and bulk code carers accordingly, and that meant that they were then highlighted for the vaccine during that point. There was a lot of communication and work that went behind the scenes to make this happen, and Wakefield were one of the first places out of West Yorkshire and Harrogate to get a really great gold standard process in place with not only good data sharing agreements and governance in place, but also work with the data quality teams to make sure that we'd ironed out any glitches or issues around this process. And one of the outcomes, and I know the number has probably gone up since then, Justine, was that we'd registered around 1,000 carers, I think in the space of about 3 weeks. So the team absolutely worked their little socks off to really get this working, and get carers registered, get the data on the system, get the data supplied to GP practices through a secure NHS account. All that took a lot of work and effort on their side. We're working with us to make that happen. Next slide, please. And I think, just moving on, because I think we're on slide 5. Do we now hand over to Maria shortly and Justine? So I think the communications, I'll just finish off. We covered that, but that was really about just getting the right communications out to carers. It was about highlighting the important message that if you are a carer, you can come forward for the vaccination. Here's how you get in touch. And this was something that we circulated far and wide across Wakefield. And as a consequence, we had a number of carers that came forward, and that included 900 new carers that were registered with the service in that 3-week period. And it worked really well. And we also had fantastic support from Dr. Debbie Hallett, our clinical champion for carers, throughout the whole process. Next slide, please. And I've touched on the data sharing and governance, and I won't labour the point because I know we're in limited time. But I think this was really key in the whole process in terms of getting this right, because it could have so easily have gone wrong. So there was an awful lot of due diligence we undertook as a team through a regular task and finish group that met up weekly to basically develop these documents, make sure that we were liaising with our governance teams and DPO to make sure that we were operating a safe, secure process and method of data sharing that was compliant. So I can't stress enough how important the governance aspects of it was, but I think this governance process is something that actually can be shared much wider than this project when it comes to sharing data between a voluntary sector service and general practice. And I think we've showed we can do that, and that we can get over a lot of the common obstacles that people face in this kind of situation. Thanks. Next slide, please. Okay, I'm going to hand over to Maria, that's going to take us through the funding and partnerships.
Thank you. So I'm Maria Clements, I work in public health. Just to say that, back to the previous slide, our carers service have always worked with primary care, But the pandemic has been an absolute catalyst for strengthening these partnerships and elevating the need to support carers, and it's created better processes and actually a legacy for that crucial information sharing and kind of joined up support for carers. So if there's anything good to come out of this pandemic for carers, that would be it. So funding and partnerships. So earlier this year we were successful, Wakefield Council was successful in securing some community champion funding from the Ministry of Housing, Communities and Local Government. And the purpose of that funding was to develop COVID messaging and vaccination messaging for people at risk of health inequalities. And we felt that it was important to include carers within the funding stream. So we awarded some money to our carers service. And I know Pam's already mentioned it, but what the service are doing are producing a series of newsletters containing factual and up-to-date information for our carers. And it also shares details of how they can access support. We've also created some partnership work with the service, Age UK and Council Transport Services to ensure that vulnerable people, including carers, that don't have access to get to vaccination sites and receive the vaccination can be supported. And we've created an enhanced vaccination pathway which has been shared with partners so that partners can refer those people in to receive that offer. The District have communicated that offer to their carers, so carers can come forward and ask for help if they're struggling. Just to mention on that, uptake has been quite low, which is good because that suggests that people are able to make their own arrangements, but we do have a fallback for people that aren't able to access the vaccinations. Young adult carers aged 16 and 17 are able to access the Pfizer vaccination, and that's been communicated to partners to share with that group. And again, the process for registering to have their information shared with GPs to be called for the vaccination is done through the same processes as it is for adult carers. And just to mention that we have put a bit of a pilot scheme in place, working with the local authority in Connexus and the carers service to identify carers that might not be able to stay at home and might be at increased risk of contracting COVID, and that pilot scheme enables them to access twice weekly lateral flow testing, so they can feel confident they're having frequent testing to ensure that they're able to keep their loved ones safe. And the service have worked hard to target people that are best, that are most going to benefit from that offer because they might not be able to stay at home. Okay, can I hand over to Justine? Next slide.
Hi everybody, Justine Bilton here from Carers Wakefield. So I'll not labour the point. I know that Pam and Maria have already painted a really good picture. What's been absolutely excellent throughout this is the partnership working and the tremendous work that the different individuals have been passionate about and ensured that we found a solution to any problem, any hurdle that we've come across. It truly has been really inspiring. So I think the message from this is that we've now registered probably from this point maybe about 1,000 new carers that were previously unidentified in Wakefield. So initially we were able to bulk upload around about 7,000, and as Pam mentioned, since then, just to give you a bit of a flavour, annually as a service, in general, we would ordinarily identify between sort of 800 to 900 new carers in a year. And obviously, within a sort of 3-week period, we'd hit that number. So I wanted to also thank the CCG for giving us some funding towards this particular piece of work as well, which has helped tremendously to be able to do that. So in such a short space of time, we've managed to reach carers that ordinarily we wouldn't have been able to do. That transfer of data happens now on a weekly basis. So any new carers that we are still identifying, go through to GP practices, and that happens generally on a Friday or a Monday. Like Pam said, you know, Debbie Hallett, thank you so much for the support that you gave us to get over some of the hurdles, and various other individuals as well. But I think what it means is it's not just about the vaccination itself. It's about that ability for carers to understand that there is some support out there, not only from ourselves as a service, as a carers service, as you would expect, but also from the GP practices as well ongoing. So in future that you know they'll be able to be invited for flu vaccinations, for example, and some of the flexible offers that some GP practices do offer to unpaid carers out there. I think what next slide, please. So just a couple of case studies. I'll not read them through to you. I think this particular one, what it sort of proves to myself is that, you know, as Maria mentioned, we have worked with GPs for a number of years, but this particular piece of work has particularly cemented that partnership, really. It's meant that we now have some really strong relationships, which means that if we've got a problem, we can resolve them really quickly because we've got that understanding with each other. We wanted to ensure that we tried to take the pressure off GP surgeries, hence the reason why we set up the registration line. We also set up a registration email, etc. And it's just proved invaluable, really. Yes, there's been a few hiccups along the way. Again, we're still ironing out a couple of those from an actual vaccination point of view, but in actual fact, what we're finding is, so for example, we found out yesterday that Navigation Walk are actually referring carers to ourselves as well. So just a tremendous amount of work and goodwill and passion from a lot of individuals has been seen through this process. Next slide, please. Again, another case study. I'll not labour on this one, but this is just typical, really, in terms of Mrs H's, you know, feeling anxious prior to getting the vaccination. And although she's continuing to do the social distancing, etc., it just been like for a lot of the country, it just gives a bit of a light at the end of the tunnel, in that she feels that little bit more secure knowing that she's had the first vaccine and is on the way to getting the second vaccine. It's just, you know, I think as you're fully aware, I'm sure a lot of people have been suffering with the mental health. Carers are no different in that and have probably suffered a little bit more than others because of the situation, and it's just a little bit of a light at the end of the tunnel. From my point of view, I really do just want to emphasise that praise and that thanks to certain individuals, you know, who have come forward and been particularly passionate about what they do. We've took a really pragmatic approach to this. So where we've come across a hurdle, I mean, Pam mentioned quite a lot of the hurdles that we came across to start off with in terms of, you know, GDPR, and data sharing agreements. But there was a solution sought with every single one of those. And we didn't stop until we found that solution and put it in place. Just been you know, really tremendous. And I do thank you all for that. I'm going to hand back to Maria just to finish off from a young carer's point of view.
Thanks, Justine. So we thought it was important to kind of give an update on young carers as well, and just to let you know some of the vision that's out there for young carers. So the youth work team have been delivering Zoom sessions to young carers throughout the pandemic, and they've also been offering welfare calls to young carers that are over the age of 11. We've also got some new initiatives in place for young carers. So previously we've not had strong support for younger young carers, but we've now got 2 Zoom sessions offered on a weekly basis for young carers who are primary school age. And the reason we've got 2 is because uptake has been really positive, and that makes the groups more manageable. So that feels like a really strong position to be in. One-to-one and family casework has increased significantly, and I think that's as a consequence of the really great new practitioner that we've got in early help, who's doing a lot of work with colleagues right across the workforce around young care awareness, and she's picking up a lot of the bulk of this casework, but she's also working closely with colleagues and partners to support young carers and their families to increase the staffing that is supporting young carers. That feels really positive. There are plans to return to face-to-face provision in a cluster model, so there'll be increased provision once we're able to kind of meet on a face-to-face basis, but we'll also consider a blended approach for young carers, because we know that some young carers actually find it easier to attend the virtual offer, so that there will be options for young carers to participate. And our early help service manager is leading on how that work will be resourced, and we've got some activities planned with the Director for Children's Services to bring together lots of partners to look at how we can effectively work together to meet the needs of young carers. There have been newsletters created for young carers and professionals, and there have been support packages delivered to young carers to give them positive things to do and acknowledge what they do as young carers, because what they're doing is remarkable. I've had a survey go out to all schools to try and create an understanding and young care awareness in schools and get a sense of how many young carers they have in their establishments, and also we'll be using them by colleagues as well, just to kind of give us a increased understanding of what young carers in schools are telling us. But we've got really strong links with the ICS, working on developing a young carers app, which contains information about being a young carer and also how to access local services. And we're also working on interactive resources and schools resource packs for the region. In Wakefield, we've had the Children's Society come in and deliver some interactive online training for colleagues that have got young carers within their brief, and we've tried to kind of think more broadly than just the kind of obvious colleagues, but invite a range of colleagues to participate in that training. And we're working to develop stronger systems for recording young carers information with our performance team. And as I've said previously, a range of partners are involved in this work, and we're hoping that things will strengthen as we come together and identify what partners can support this agenda. Thank you.
Thank you, everybody. That was an absolutely fantastic presentation. I mean, you answered quite a lot of my questions as we went through, but I can't say thank you enough, really. As I said, the presentation was excellent and fantastic work on the vaccine and your support for carers. And I think what you said about the strengthening partnership working as well, we can just see that from the 3 of you presenting together as well, which is, as I say, it's absolutely fantastic. Can I bring Mel in first, please?
Thank you, Chair. I just wanted to highlight, if I can, to the board, this is a great example of how our place in Wakefield have worked really collaboratively with the integrated care system and the leadership from across both partnerships that have taken us forward. But I just also want to say a personal thank you to Justine and her team, because this has obviously involved thousands of carers contacting Carers Wakefield in a very short period of time, and obviously it's not just been about making sure that we get people registered in the right place in terms of COVID vaccination, but it's all the support that comes with it from Justine's team, and the fact that we've almost registered a full year of carers in the space of a month, really, because of this work, just shows you the impact that really all the energy of our partners put into delivering this success success. And it's not this was never about any additional financial resources. This was about partners willing to work together differently, to do something differently, to support any anxiety carers might have had around an issue that we were dealing with in the pandemic. And I'm very proud to hear such a positive impact, and it's great to hear from Maria about all the great work that's underway on young carers. So just wanted to highlight that, Chair. Thank you.
Thank you, Mel. Debbie, would you like to come in?
Yes, thank you. Hi, I'm Debbie Hallett. I'm a GP and a governing body member at the CCG and clinical carers champion. So yeah, just to say it is an incredible piece of work, and just to acknowledge that Carers Wakefield were already working with primary care prior to the pandemic, helping us to register for the NHSE quality markers scheme. And obviously with the pandemic, everything was thrown up in the air, and we obviously have been ploughing on through that. But this was such an opportunity to bring carers to the forefront again. And I'm very grateful for all the support from the CCG in terms of the funding side of it, but also just from Carers Wakefield and from Pam in terms of the absolute pragmatism and flexibility and persistence and determination that's actually brought us to this point. So I really can't thank them enough. We've got, as Pam said, a governance process hopefully that will support working between primary care and other voluntary care sector organisations going forward also. And you know, the information governance team are bent over backwards to support us with that aspect. And really just a final word to thank the carers in, you know, all across the country in Wakefield, who are obviously doing this day in, day out, and it was sort of the least we could do to support them, I think.
Yeah, thank you very much for those comments, Debbie. Esther, would you like to come in?
And it's a bit difficult to follow Debbie's last comment because that's probably the most powerful comment that you could have. But just also to highlight that I think Pam and Justine and Maria probably are too humble to say that they were actually applauded last week for the work that's being done across the ICS and in each of the places around the working carers passport, and that they achieved quite a high accolade in the Health Service Journal of Workforce Initiative of the Year. So just really to highlight that, and that these three's work on that has been absolutely amazing as well.
Thank you, Esther, that's great. Do we have any other comments or questions for the ladies? No? Okay, so thank you again. As I say, well, I certainly can't thank you enough, you know, for the real difference that it makes to us residents. You know, from the people I work with and people I've spoken to across communities, I do know that people have felt a difference from the work that you've done. So thank you all very much. So with that, if I can ask the board to support the recommendations as highlighted in your agenda pack. Is that okay with everyone? I'll take it that silence is okay, thank you. So thank you very much for that. So just before I move on to the items for information, I'd just like to thank everybody for the contributions today. I think we've had a very varied and interesting agenda, so thank you. Okay, so that takes us on to item 9, which is the Connecting Care Executive Minutes, which can be found on pages 43 to 60 of your agenda pack. Mel, I don't know if there's anything you'd like to add to those.
Yeah, I just wanted to highlight that back in January, Nova did a great job through the leadership of Maddie and Rich to launch our third sector framework to all of our voluntary community sector organisations in Wakefield. So that was discussed in the Connecting Care Executive Minutes in January. And really this is going to be a transparent mechanism to allocate funding across Wakefield's third sector. And I'm very much looking forward to working with Rich and Nicola and Maddie in the coming months about how that takes shape, and just encourage everyone to be aware that we have got that. If you haven't seen that third sector framework, Maddie and Rich Jones will be able to share that with you, and I think it's something to encourage us all to work towards in terms of how we ensure our VCS sector are leading the way in shaping our services in Wakefield. And then the only other thing I wanted to mention just briefly, Faith, is that we talked about strengthening Wakefield families together in the work with the Children and People's Partnership, which obviously takes forward the Best Start to Life priority on behalf of the Health and Wellbeing Board. And I just wanted to share that through a successful partnership working approach between Mid Yorkshire Swift, the CCG and the Council, we've just recently appointed a Service Director for Health and Wellbeing, a girl called Jenny Lingrell, who starts in June into our service, into our system. So that's really exciting, and that brings together the council and health and care working together to improve the wellbeing of children and people for Wakefield. So if that's okay, Chair, I'll just leave it there.
Thank you, Mel. Okay, so that takes us to the date and time for the next meeting. So this will be confirmed after ratification at full council. So it's initially planned for the 15th of July. If we can sort of hold that in our diaries. We are hoping to have a development session in May or June, as it's been a while since we've done one due to COVID. I think the one that we had planned last summer, which obviously didn't take place, was around climate change. But it would be good to be able to get another session in the diary when we can, and I would encourage everybody if they can prioritise the date when we get it to you. So thank you very much. So that brings us to the end of the agenda, and again I'd like to thank everybody for your contributions today and for your attendance. So thank you very much.